comments.
Thank you very much, Mr. Kelly. Reap what you sow. Tell me what you were going to say.
What I was going to say was, if you look at the history of this law, well, I'm sorry you'd resent that. But the reality is that the law was passed without any support on the Republican side. So here you are, you force something down the throats of, and I feel this way as a business person, you're forcing this down my throat. I've got no say in the process. You had no say in the process. And now, because it's not going very well, because the implementation is difficult, all of a sudden, you folks are the problem. And I find that really reprehensible that is said. I think if it had been really a spirit of comedy and bipartisanship 4 years ago, perhaps what we would have would be something that would be implementable and affordable. But it doesn't turn out that way. I'm sorry.
And
Will
Mr. Kelly,
the gentleman yield?
I will not at this time. I only have 4 minutes left. And Mr. Kelly, would you agree with me that there's more than just snags in this bill? It's more than just a few snags?
Absolutely. Absolutely.
And I would have to say that among the things that my constituents tell me are snags, and what I've heard testimony here today is we've got the long-term care insurance part didn't work out, so they abandoned it. The catastrophic coverage that was to be the interim step cost a lot more than it was originally projected to cost. The insurance rates didn't react the way they thought they were going to do. We haven't seen any real savings there. The Secretary is having to go out and look for more money to try to get folks to enroll in the programs and to do the things that they want to do. We've got the 29ers that we've referred to several times today, which even if we were to change it tomorrow, the Commonwealth of Virginia has a law coming in July 1 that says that they can't have part-time workers that work longer than that because they don't want to have to pick up that cost. The Medicaid, forcing the states to do the Medicaid expansion, was ruled unconstitutional by the Supreme Court. You've got problem after problem after problem, and I kind of think this is similar to Blacksburg High School in my district. The roof of the gym caved in, and the debate began, do we just build a new gym, or what about the rest of the building? And it caved in because of structural defects. And the ultimate decision was they condemned the rest of the building, and they're going to build a new Blacksburg High School. Sometimes when the construction, the initial part of putting something together, putting a building together, is so poor, you have to just say, okay, let's start over, let's go back and see what we can do to build something that does work for the American people, that does lower costs, that does expand coverage in the ways that we want to, and doesn't cost people the hours at work or jobs. Would you not agree with that, Mr. Kelly?
Absolutely.
And Mr. Lazinski?
Sure.
And Mr. Marr, as a businessman, if something is structurally flawed, don't you sometimes have to just say, okay, we're going to scrap that, bulldoze it, and start over?
In our business, sometimes we do that.
Yeah. I mean, I think everybody who's been in business very long has run into that position where they have to do that, or they have to go back and say, that didn't work. And I would submit to you all and to this committee that that's where we are on this particular plan. It was built poorly. It's not going to work as currently designed. I don't know how many patches we could put on it. I don't think we could put enough patches on it to fix it. I think we have to tear down the building and start rebuilding. And so I would ask you all about that. Have any of you all run into the 29-hour problem in your particular business where you have had to say to employees, we're only going to give you 29 hours?
Yes.
Mr. Lazinski, I think
Yes,
you
I
mentioned
have.
that earlier.
Mm-hmm.
Yeah, and I will tell you, I'm going to ask you this. I have a business in my district, and see if you all have had this problem or if you know folks who do. This business has been in existence more than 30 years. It now has 59 employees. They have 3 shifts. One of the shifts they just started a few years ago. So the businessman came to me and he said, I just left my folks. This was a couple of months ago now, and I don't know what decision he ultimately made. He says, here are my decisions. I can lay off the 3rd shift. It's marginally profitable. I worked for years to get it off the ground, but I can lay off the 3rd shift and get below the 50 employees. So I'm in the same position that Mr. Bray, he didn't use Mr. Bray's name obviously, but I can be in a position where I'm not covered by this bill. I can pay $40,000 in the fines, or I can pay $60-some thousand and cover everybody. And I've been covering, kind of like you, Mr. Lazinski. He's got a lot of folks that don't last in the business. He's in a business where some come in and stay for a couple of months and then they move on. But some stay for a while. And when they stay for a while, they get a supervisory position.
Correct.
And he's been covering all those folks for years. And he said, so my choices are for the first time in over 30 years, don't grow my business anymore, cut back, and lay folks off, pay a fine, or pay $40,000 fine or a $60,000 increase. And he doesn't know what he's going to do, and he's wringing his hands over it. Have you all found that to be true as well?
Yes, I have, yes.
Yes.